I'm happy to start with that one because this is the exciting part. This is why we're all here, right? And there is actually so much that we can do. There is so much that is known, even though it's an emerging field in science. There's actually a ton that we already know and can do. And using stress biology is a way to really lift up the science and bring it into our current practice, our clinical practice. And we can then think of two broad areas and both sides of the equation, the stressors and the internal stress biology. And I love, Adivika's your example of the stressors, right? Understanding, active listening, really working with our families to partner on what are the stressors and how can we help decrease blame and shame and really lighten that stressor burden, which is exactly what you did, Davika, for your patient, which is amazing. And we can look at that internal biological stress response, which often does get missed by traditional Western medicine. And so when we're seeing kiddos, we're adults, but we're a pediatric setting where the stress response, again, has been overactivated or prolonged. And now the person, the child is stuck in that survival mode. They have this nervous system, endocrine, immune dysregulation. There are things we can do across all those systems to help them out. One thing I think of right away is how can I help them in the moment when they're feeling that stress response? How can we start helping them connect with the feelings and sensations within their body and have healthy coping strategies to normalize and deal with those feelings? Because a lot of times, and I think, Journey, you might talk about this, because a lot of times we just get so nervous that we have cancer or something, something that like nobody's just found yet. And once you know that it's nervous system dysregulation, we can really think about helping people lower their stress hormone levels in the moment. That can include things like breathing techniques and grounding practices and sensory practices, movement, just releasing that stress energy, and teaching parents co-regulation techniques, right? That turning that affiliate response, tapping into that. And then how do we get unstuck? If we've already developed some of those neural patterns, how do we re-regulate them? How do we build new neuronal pathways? And how do we reset the endocrine and immune system, right? That dysregulation that's happening across our brain and body, that's leading and manifesting as the chronic pain, the headaches, the stomach aches, the diabetes, anxiety, depression, right? How can we do this from a stress biology perspective? And I think I like how people are bringing up cases, because I think that's a great way to really think about what we mean concretely. And so picture a kid with ADHD and behavior issues. And the stimulant medication was tried, but it actually made it worse, which, if you take a step back, is not surprising for this kiddo, because when you look at the full picture, kind of like Jarena was talking about, you see that there's multiple systems involved. So pre-diabetic and having frequent asthma exacerbations. So now we have neurologic and endocrine and immune systems that are dysregulated. And with that active listening and talking with the child, we find out that there are some stressors in their life. And the ADHD then might not actually be ADHD, right? It might actually be a child stuck in that toxic stress response. And so first, or I should say at the same time, looking at those current stressors and partnering with the family and addressing the internal stress response. And so at StressWell, we do a full assessment. So while there's not a gold standard, we are starting to develop the ways to figure out what's happening across all these systems through self-report questionnaires and labs and a physical exam to really think about what's happening inside for that kiddo across sensory motor, pain, arousal systems, reward processing, the autonomic nervous system, cortisol, right, endocrine, immune, cognitive attachment. And so for this patient, what we find is that they were having significant sleep and arousal issues, which we could target with neurofeedback. They had immune dysregulation with elevated CRP levels and low vitamin D. So we talked about an anti-inflammatory diet, right? And in particular, we agreed on partnering around decreasing processed foods, because if you don't recognize the name of the ingredient, there's a good chance your immune system doesn't either, right? So we can attack that. And we did supplements, so omega-3s and curcumin for that anti-inflammatory effect, and then vitamin D because they had the low vitamin D levels, and medication management for people who are interested in that, families that are interested. If we know that the child is having executive function problems and impulsivity because they're overstimulated, right? Stimulants actually don't make sense in that situation. You're actually kind of adding catecholamines to an over-catecholamine system. And so in that case, guanfacine and alpha-2 agonists would be probably a better choice, right? Lowers blood pressure, regulates release of noradrenaline, so decreases the catecholamine load and burden, and gets that executive functioning prefrontal cortex back online. So again, using that stress biology, using a full comprehensive assessment, we can start treating and targeting the particular ways that stress is showing up in the systems for that particular kiddo.